Okay, welcome everybody to this session about drug. With me, I have three experts from different fields. We've got Dr. Alex Stevens, Professor of Criminal Justice at the University of Kent. We've got Jason Q, Senior Innovative Practice Manager at the Centre for Justice Innovation, and Jane Bailey, Superintendent for West Midlands, in charge of their drugs diversion pilot. Jason, before we get into resolving drugs crime out of court, can you paint a picture of what happens to somebody accused of a relatively low-level drugs crime if they're prosecuted in the magistrate's court? What kind of sanction do they get, and what good does it do them?
Yeah, that's a really good question. In fact, just before Christmas, I visited our community advice service in Highbury Magistrates, and so our centre supports community advice, which looks at multidisciplinary needs. And there was a gent there that we met in the morning. He'd been found crossing a barrier by British Transport Police and sent to court, so charged first appearance for a drug offence. And he was looking at a fine. He spoke to his solicitor, but he was homeless, had active addiction with other drugs, yet he was found with cannabis. And that fine would not have touched the complex needs or the multidisciplinary needs like homelessness that he was experiencing. Yet the fine would have just caused more of a social harm, but obviously more of a harm to him. He wouldn't be able to pay, for instance, and that would have been mixed up in the other fines that he was subjected to as well. So to answer your question bluntly, the result is harmful.
Because most of it is, for the low-level offences, is a fine which people either struggle to pay or can't pay. Jane, you're overseeing a new programme in the West Midlands for resolving drugs cases out of court. Why did the West Midlands Police set it up?
Because we wanted to develop more of a health outcome rather than a criminal justice outcome to addictions and ensure that we were able to divert people away from the criminal justice system. And probably one of the big drivers when we look at, if we think about cannabis possession, tends to be a younger age demographic. Actually, it was about ensuring that we are able to retain children and young people in education and employment opportunities for the future, and thinking about an alternative methodology of dealing with personal possession of drugs gives us the opportunity to be able to do that so that people aren't criminalised at an early age. Got that the wrong way around. Which then means they can then be able to fulfil their full potential, which actually might be quite an exploratory stage in a young person's development as well. So that was the intention, really. But you do need synergy as well of thought with your Chief Constable and your Police and Crime Commissioner to enable you to develop such schemes.
So in terms of what the people on your scheme actually have to do, what do they have to do?
So in essence, the way it works is, I think Jonathan talked about the platform earlier, but we've got an app that all of our officers have on their mobility devices. So when the predominant range of drug offences for personal possession that we deal with, a large portion of those come from Stop Search, which is intelligence-led around policing issues and policing problems. And so the way it works is officers will use their mobility device and they'll have an application on there, and as soon as they identify possession of controlled drugs, they'll talk to the individual, find out a little bit about them, and then they will offer them the community resolution through connecting the individual with the drug support provider through the application. And what that then means is that they agree to go as part of that community resolution for a one-to-one assessment with their drug support provider, and that appointment is made through the use of that app. And then they also have a follow-up where they have more group assessment. And there's also the opportunity to be referred, all of the people, young people who are referred in through the app also are shared with our YOS colleagues so that they've got full sight of those individuals, and where they need to be referred outside of the drug support provider for mental health, trauma-informed approach, other types of intervention, that work is undertaken as well. So it does offer that sort of safeguarding aspect. So if we've got a young person who might be subject of county lines or is being in some way enforced, then there's an opportunity for that to be identified as part of that sort of agency support in terms of that initial referral.
Okay. Alex, you're leading a research programme looking at police-led drugs diversion programmes. But police have been diverting people accused of drugs crimes for decades. Isn't there evidence already as to whether it works?
I suppose it depends what you mean by diversion, and it depends which outcomes you're looking at. So I've been researching alternatives to criminalisation for drug possession for a long time. And diversion is just one of the ways that people can be deflected away from the criminal justice system. I mean, take, for example, the cannabis warning that was introduced in Lambeth in 2000 and then nationally in 2004. That is an alternative to criminalising someone, but it didn't divert to anything because it was just a paper warning and on your way.
I mean, of course, a community resolution is still criminalisation of some kind, isn't it? Because it's a police sort of informal sanction. So the West Midlands programme is one of the ones you're looking at. What are the others, and how do these diversion programmes, because you're researching them with a government-funded evaluation project over the next couple of years, how do these approaches differ one from another in the ones that you're looking at?
Yes, so the three schemes we've been funded to look at by the Cabinet Office are the West Midlands approach, Divert, the Thames Valley approach that Jason developed when he was at Thames Valley, and we're also looking at Checkpoint in Durham. But as we're getting into this, and my colleague Nadine Hendry is here from the University of Kent, who's working with me on this, and Brian Eastwood from the Office of Health Improvement and Disparities, as we're getting into it, realising the subtleties of all this, because in each of those areas, and in many other areas, there's not just one way of doing diversion. And some of that is written down as to what a police officer is supposed to do. We found that, the police officers we spoke to recently in the West Midlands had quite a clear understanding, and the use of the app helped that understanding of what they were supposed to be doing with each offender. But there's a plethora of other ways that the police can deal with a particular offence. So one of the things we want to really get into with the qualitative side of our evaluation is to really understand the circumstances in which people have been diverted, what the decision-making process that the police are using, and what the effect is, because the effect can be, as you suggested, Penelope, an increase, what we in criminology call net widening. That's possible, that we're sucking more people into the system. And when, as a criminologist, when people like Chris Baker in the previous session say that something is always better than nothing, well, we get a little bit itchy because there's plenty of somethings in the past have proved to be worse than nothing, and we need to keep an open mind as evaluators of what something is doing.
So, Jason and Jane, you've got, say, an 18-year-old found with a small amount of cannabis, never found, first time. Should they get any kind of criminal sanction?
Well, no, because the evidence, as we heard, is counterproductive. It's more harmful, that causes more harm than good. There's the ethos of the Thames Valley scheme was around putting a very swift intervention from the drug service provider. So the young person would hear from the drug service on that day or the day after, and that was crucial to the success of the scheme. And it was multidisciplinary, so it's not just about drugs. It could be sexual health, mental health, domestic abuse, education. Basically an access doorway, if you like, to a hub of interventions that might be appropriate for that individual. And it's about also that person's life chances. And that's why drug diversion has been incorporated into schools within Thames Valley, within selected schools when I had that responsibility, to preclude exclusions, again, for the same harmful reasons. So diversion is not just the role of police, it's the role of education, the whole system coming together to actually deal with what is a controlled substance at the time. And going back to the cannabis point, not to prolong this, but you know, the education could be as simple as the fact actually the craving that you're experiencing from using cannabis might not be the cannabis at all.
Can I ask Caroline, are we winding up from the other room? Okay, great. Everybody, can we give a clap to our panel because we got the next panel coming?